In this section of the educational series, we're going to go through two of the most important pharmacogenomic resources, the CPIC website and the PharmGKB website. Throughout this presentation, we will explore these two web pages and along the way, hopefully help you to identify ways in which you can utilize each of these resources in your practice. So the first website I want to go through is the CPIC website found at CPICPGX.org. It is the Clinical Pharmacogenetics Implementation Consortium website, which is a group of volunteers and dedicated staff who put together this website to aid in facilitating the use of these pharmacogenomic tests that we will be using and help providers, pharmacists, and patients interpret their results. If you go up to the top, you'll see various sections of the website. I would say the most used link for providers will probably be this guideline tab. So this will bring you to the guidelines section of the CPIC website, and you'll see an explanation as to what you can find in this particular section. There's also links to some more information as to how the guidelines are put together. If you look, you'll see a link to the strength of each prescribing recommendation, as each of these guidelines is associated with a particular strength and graded level of evidence. And so if we click on that, it'll pull up the strength of recommendations and explain each one and what it means for that particular guideline. So this is really important that we understand what we are reading, but also and how to use it, and also how relevant it actually is to clinical practice based on what we do know and what literature is out there. So if you go back to that guideline tab and you scroll down past that introductory paragraph section, you'll see this, and this will give you each of those guidelines separated out into what drugs they are relevant for and the genes that they are connected to. Normally the guidelines are titled with the gene and drug names unless it is for a particular category or class of medications, in which it will label it such as NSAIDs and then list all of the drugs to which this guideline may or may not apply to. And so there is a document that's available on the Pharmacy Resource Center that has links to PDFs of each of these guidelines. So there's two PDFs. One is sorted by gene. So in case you have a particular patient you're looking at, trying to figure out what the best medication option is for them, you can pull in that genotype and phenotype that has the that is of concern, and then see which drugs that may affect. And then on the other hand, there is also one that separates it out by drug, in case you are looking at a particular drug and want to see what may be included in its metabolism pathway, or what genes may impact your use of this particular medication, and then look at the patient's report and see if there are any connections. So really it's just available for people to look at each gene or each drug collectively so that you're able to see it all in whatever way works best for you when you're looking through information. So at the top of the page, next to the guideline tab, there's a genes drugs tab, and this will give you all available information for any drug gene connection known out there currently. And then they will also be graded based on their level of evidence. So for some of these medications and their gene correspondent, we don't have a whole lot of information or data, but we do know that to some capacity they are linked. So if you scroll further down past that introductory paragraph explaining this particular tab, you will see this chart. And so these are listed partially in alphabetical order and partially by the level of evidence, so that you're able to see the drug gene pairs that have a higher level of evidence first. So you'll see the CPIC level, and then the PharmGKB level of evidence. And those are explained in those previous tabs that I had mentioned with explaining the levels of evidence. And then you'll also see this section titled PGX on FDA label, or pharmacogenetics on FDA labels. So if there is any mention of pharmacogenomics testing, whether or not there's guideline information out there, then it's listed on the label. You'll see something right here. There's also a link to each of the guidelines that are implicated in those gene drug pairs, if that exists. And so these FDA label sections indicate whether or not testing is required. There is actionable pharmacogenomic information that would be gathered. And then there's a couple of other potential things you may see in this category that I'll go through on the next slide. But in this particular case, if you had a patient that you knew had some variant for HLA-B and you were considering putting them on abacavir for any reason, this is showing that the FDA is requiring that testing be performed to ensure patient safety. Versus if you look at amitriptyline, this is just showing that it's not necessarily required. However, performing pharmacogenomic testing would be really important in this patient because it would give you information that have guidelines that match with that information, so that you are able to actually make a recommendation based on the results of the pharmacogenomic testing. So here are some more examples. As you can see, for mercaptopurine, testing is recommended if you want to, because there is a link between TPMT and mercaptopurine, and so they recommend that for patients who do not have any information on their TPMT available to get testing, so that they can make sure that we're keeping the patients safe and they're not going to have a serious reaction. And then if you look down further, you'll see the section that says informative PGX. And so this means that we know that there's an association between CYP2D6 and ondansetron or Zofran. There's a guideline that exists. However, it may or may not be actionable because the variance in metabolism for this particular drug just may not be as clinically significant or actionable as with other drugs. However, it will give you good information to use on how to maybe dose the medication, or whether or not you would maybe use a different antiemetic for that patient. And if you scroll all the way down to the bottom, you will see that there are 377 known gene drug pairs as of the time when this presentation has been created. They're constantly adding new ones if they find out any more information, or moving them further up the list if more information is published or if a guideline is published. But this is just to show you that there are 377 current known gene drug pairs or interactions or some sort of association between gene and drug that we currently know of. So another section I wanted to point out is the resources tab on the CPIC website. So this gives you a chance to look over some more information put out there by the CPIC team and what they do and how the process works. And it also gives you a lot of information on the terminology that is used in CPIC guidelines and how they came up with the use of those standardized terms. And then the list goes on for different resources within the CPIC website that may be helpful when you're trying to figure out some more information on a patient-specific pharmacogenomic question. All right, and then the second website that I want to go through is the PharmGKB website. This has a lot more information than the CPIC website simply because it has a lot more detailed information. It separates it out into drugs that have annotations that are related to pharmacogenomics. It goes through each of the pathways of metabolism or any pharmacodynamic process related to the use of medications. It is also a place where you can find these clinical guidelines, but it's not just CPIC guidelines, it's also other clinical guidelines that exist across the country in other organizations. And we can talk about that a little bit later as we work through the PharmGKB website. But this is what it'll look like, and it's not necessarily the most user-friendly for those who have not been shown how to use the web page. So I think that this is a really important section of this presentation, and I'm going to start with the curated pathways section. So if you click on that Curated Pathways tab, it brings you to this web page, and it will first list all of the pathways that are known. As of the time that this presentation has been created, there are 149 known drug metabolism or some sort of pharmacodynamic process pathway that is known. And you can separate it out by specific types of medications. If you look over at the category section on the left-hand side, you'll see that you can sort it out by antibiotics, anti-cancer agents, and so forth. But you can also use this filter button, and you can type in a particular drug subclass or drug that you want to see if there is a pathway. So if we type in sertraline, we will see that there is a pathway specific for sertraline. It's related to the pharmacokinetics of the drug. It tells you that it's a neurological agent. And if we click into that, here you can see the pathway. So this is showing you the particular metabolism pathway. So it's showing you inside of a liver cell, when you have the parent compound, what transporters and CYP enzymes are responsible for its metabolism, what it is metabolized into, and all the way down to what it's excreted as. And then it looks like there's also another pathway that is related to sertraline but does not necessarily come up when you search for the drug. But as a class, the selective serotonin reuptake inhibitors have a pathway, a pharmacodynamic pathway that shows how they are transported and the process of actual serotonin reuptake in the brain. So if you click on that, it'll take you to that pathway so you can get a little bit more information of all of the components that are involved. If you scroll down a bit further, it'll also give you a lot more information on sertraline as a drug, what it's used for, common side effects, the pharmacokinetic information. So this is a lot of the information that's available on a number of other drug information websites, such as UpToDate or Micromedics, but it's all here all at once so that you are able to have a one-stop shop for all of your information if you're dealing with a pharmacogenomic question. Now if we go back to the main page and we click on the Clinical Guideline Annotation tab, that'll take us to this screen. And so this shows you all of the clinical guidelines that have been published throughout the world for each particular drug that any information or any clinical guideline is currently published. So we have our CPIC drugs in that first category, but then if you look next to that, you have the Royal Dutch Association for the Advancement of Pharmacy and Pharmacogenomics Working Group. That's the DPWG, and they have a number of guidelines that have been published. And then you'll have the Canadian version, and then there are some other guidelines that are out there that have been published that aren't necessarily under a working group, but they are still important and can be very helpful to guide our practice. I would say that overall we put a lot of value in the CPIC guidelines. However, if nothing exists in a CPIC guideline, it may be helpful to at least see what else is out there. So this is just an example, scrolling down a little bit further on what this will look like as you continue to look through the different medications. So there are going to be some medications that only have information that has been published outside of CPIC guidelines, and therefore it may be helpful to click on that box and read a little bit more about that particular gene-drug association that has been described in that guideline. And so each of these are clickable links to go to the documents that give you all of that guideline information. All right, and if we go back to that main page and we click on the drug label annotations this time, that'll bring you to this page. And in this case, because we live in the US, we really only care about the FDA biomarker drugs. And so if you click this box at the top, it'll separate out all drugs that have a label annotation in a different country. So for example, if you look down at the bottom, the acinocumarol, we don't really use that in the United States. It has a Swissmedic label, but we don't have anything for the FDA. And so this is just really helpful to kind of cut down on the number of drugs you'll see. But as you can see, 335 of the 381 drug label annotations are FDA biomarker drugs, but at least this kind of eliminates some of the other ones that we do not have any information for that would be relevant in the United States. So this will give you information on if the FDA includes any information in the labeling at all about this drug in relation to pharmacogenomics in general. So if you look at abacavir, it shows that if you are considering putting a patient on abacavir, the FDA suggests, actually requires that you perform pharmacogenomic testing in order to make sure that this drug will be safe. And then there is also an alternate drug recommendation if you click further into this link. If your patient cannot get testing for any reason, financially, logistically, something else that you could consider that maybe wouldn't require pharmacogenomic testing. And then scrolling down further, you'll see like amitriptyline at the bottom. There is an annotation in the FDA label for this drug that shows that if you do perform pharmacogenomic testing for a patient, or if they already have results of a prior pharmacogenomic test, that would be helpful in guiding dosing of this particular medication, and there may be actionable pharmacogenomics. Another way that you can use the PharmGKB website is simply to just search the website. So you can search particular CYP enzymes, transporter genes. I would not recommend putting in a specific genotype, simply because without the information on what gene it's related to, you're going to get a lot of unnecessary information. But you can also type in a drug name if you're interested in a particular drug and what pharmacogenomic information is out there. So for example, let's type in sertraline and see what we get. So this shows us all of the available results with the name sertraline in the title, sorting it by what the website believes is the most relevant or what we're probably looking for, all the way down to the bottom. And so as you can see, the top one is the molecule, which will provide a lot of information, seeing that if you look below it, it has multiple tabs associated with that molecule. If you look below that, that's the pathway that we went to in the beginning. And then the molecules near the bottom are the inactive metabolites of this medication. So it's just giving you some more information. If you clicked into there, you might see if, although this particular component of the drug is inactive, what does that mean for the patient? How is that metabolite cleared? Things like that. But let's click on. So if we click on the molecule sertraline, it brings us to this web page, gives you all of that information, shows you the structure. Then there are tabs on the side for prescribing info, if there are any clinical annotations or variant annotations, links to literature, the pathway, some of the things that we saw in the beginning, but it's just a different way of searching for things so that you understand how to use each specific component of the website. The clinical annotation tab is going to be really helpful because this is going to show you all of the variants that this medication is related to, the gene, and if there's any evidence that may guide how you use this medication depending on what the patient's pharmacogenomic profile looks like. And so it has links to each of these guidelines or pieces of literature to describe its implication. So if you were to click that top Read Now button, it would take you to the CYP2C19 guideline, likely related to SSRIs, but would give you detailed information on sertraline specifically as well. So that is some deep dives into how to use and navigate the CPIC and the PharmGKB websites. I think it is incredibly important to understand how to navigate these websites as they are constantly being updated with new information and overall serve as a very, very good reference for how to interpret patient-specific pharmacogenomic data and help guide you in your decision-making process in practice with regards to medication prescribing. So I really want to thank you for listening to this presentation as well. This was one of the longer presentations. If anything in here is confusing or needs clarification, if you have any questions at all about using these websites, please email me. I'm available to answer any questions you have on pharmacogenomics in general. And again, thanks for listening.